Hello, my name is Dr. Nicole Wozniak. I am a fully licensed psychologist with McCaskill Family Services. I thought today I would do a brief webinar on some tips for recognizing depressive symptoms in teens. Specifically right now with the environment that we're in with the coronavirus and kids coming out of missing months of school, isolation from their friends and things like that. As psychologists, what we're noticing is sort of an increase in depressive symptoms and things that look like depressive symptoms in teens. And we thought it might be helpful to not only discern between what's kind of normal and what's a red flag, but as well as to offer some alternative resources apart from just regular office therapy that could be helpful in treating these kinds of disorders. So first of all, there are a number of things that can cause depression in teens. Right now, isolation from friends and school stress seem to be the biggest ones that we're seeing. It is important to note that almost all depression begins with an abnormality in some of the chemicals in the brain, specifically certain neurotransmitters being either in overabundance or not enough presence in the brain. Hence why many treatments for depression include psychotropic medication management. However, this is not necessarily the number one thing with medication that can treat depression. So while it is a focus of what's going on in the brain, we want to talk also about all the situational things that are happening, because for teens, in many cases, depression is situationally based. So poor peer relationships, experiencing a bad breakup with a boyfriend, experiencing isolation, or being excluded from friend groups, school stress, anything from grades to struggling with an online format to study or test anxiety, conflicts at home between family members with siblings, sibling rivalry, poor self-esteem in general. Obviously, this can certainly be an offshoot of depression, poor self-esteem, but at the same time, it is also one of the things that can potentially cause depression. Bullying, obviously, is going to potentially cause an increase in depressive symptoms in teens. And there are many, many other reasons, hormones, major illnesses or injuries, anxieties, learning disabilities, ADHD, things like that, that play a role in depressive symptoms with teens. So a big question that we get a lot is like, what do we look for depression in teens? So not always is your teen going to talk to you about their symptoms. In fact, it's more likely that they're not going to open up verbally about it, and instead we're just going to be looking for certain things. So of course, frequent crying spells, expressing hopelessness or worthlessness, expressing thoughts of death and suicide, those could be fairly obvious signs of depression. But like I just said, it's not very common for a teen to just walk in and say, I feel hopeless. Rather, what we're going to end up seeing are a set of symptoms that are abnormal or different from what the teen normally presents like. So we're going to talk about each of those symptoms in detail. So we're going to start first with sleep disturbance. So obviously, if those of you who have teenagers understand that teenagers often operate on a different sleep schedule than we do, as well as what we might deem healthy. They tend to want to stay up later and get up later, which obviously is a problem when we talk about transitioning back into school and things like that. In the summer months, it's not uncommon for kids to want to stay up late talking to friends and then to sleep into the day. Obviously, we want to promote a healthy sleep environment, and we'll talk a little bit more about that at the end. But as far as what's normal and what's not normal, if we're talking about in the school time months and your child is staying up all night long and refusing to get out of bed to go to school in the morning, then we potentially have a problem. In the summer months, if we have a kid who stays up all night and then is staying in bed all day throughout the following day and then not leaving the room and things like that, that could also potentially be a red flag. Wanting to stay up till 2 or 3 o'clock in the morning, talking on the phone with friends or having sleepovers or that kind of thing is fairly normal. But we do want to see the child or teen getting up and moving throughout the day following that sleep cycle. If your child is fighting going to sleep at night, so they're complaining that they don't want to go to bed, that there's, an issue with falling asleep, that they can't fall asleep, those are kind of red flags. It should take anywhere, depending on how tired somebody is, between 10 to 40 minutes for somebody to fall asleep at night. 40 minutes is on the long side, that's sort of pushing it. But if your child or teen is complaining that it's taking them an hour, 2 hours, 3 hours to fall asleep at night, and it's causing them to not even want to go to bed or to complain about anxiety regarding sleep, then we have a big problem, or potentially have a big problem. If they're complaining about waking up frequently during the middle of the night, this one is fairly common in terms of depression. People don't get restful sleep. So it's important to remember, as I talked about earlier, that the chemicals in your brain play a role in depression. So when that chemical imbalance happens, it can also affect things like sleep. So if you're not getting into that solid REM sleep and you're frequently waking up, that can be a sign of depression. It can also be something that sort of precipitates or causes depression as well. It's not going to be the sole cause of depression, but certainly being tired all the time and struggling to sleep might be an indicator of depression or a potential exacerbator. Appetite disturbance is another area that we look at. So again, we've got that chemical imbalance in the brain, and we want to think about how that affects things like eating as well. A lot of times with depression, what we'll see is a loss of appetite. You just feel stressed. Kids don't feel like eating. They don't think about eating, or they do feel like eating and they complain of nausea or something like that. On the flip side of that, depression can also cause people to eat too much or engage in what's called emotional eating. Often this is on unhealthy foods. As teenagers, it's important to acknowledge that they're not always going to choose the healthy choice, right? That's normal. If your kid reaches for a pack of Oreos versus a banana, nothing to fret about there. What we're looking at is if we're eating an entire package of Oreos in one sitting, we're not eating any other healthy food, or on the flip side of that, refusing favorite foods, not coming downstairs for dinner, complaining constantly that they're just not hungry or they have no appetite. That's a pretty good indicator of depression. Isolation from others. So this is obviously a really big one right now. As the country is starting to open up, I'm finding that my clients in particular are having a little easier time with this. But as far as what was going on with the coronavirus, kids were having a really hard time. Adolescents are very social creatures. They tend to want to be around other people. They want to be talking to other people. Of course, there are the exceptions here and there with kids with social anxiety. Some kids with autism, things like that, may have less of a social interest. But in general, kids want to be around their friends. So when we put them in an environment where we ask them to isolate from others, that is potentially going to cause a lot of problems. But also, if a kid is isolating on their own, and when I say isolating, what I mean is that their social habits have changed drastically. So you've got a kid who normally loves to hang out with their friends, they love to go to sleepovers, they are on a sports team, whatever their habits are. And then all of a sudden they're saying, yeah, I just don't feel like hanging out with my friends. I just want to be alone. I don't feel like coming out of my room right now. Okay, that's not normal teen behavior. So for all of this, we need to take stock sort of what your child or your teen is normally like and what you're seeing that could potentially be a red flag or a difference. Anytime you hear comments that seem very all or nothing in nature, nobody likes me, I have no friends, my life is never going to get any better, I'm always going to be this way, I'm never going to find a boyfriend or girlfriend. Even if you know these statements are false, so you know that your child has a great group of friends who love them and are constantly trying to get a hold of them, when you hear that from your teen, knowing that they have that group of friends, that's a big red flag, because what that's saying is that the teen's thoughts, nobody likes me, I have no friends, are driving the ship, and your teen is no longer driving the ship. And when those negative thoughts start to drive the ship, that's when we see the emergence of depression. Depression is largely caused by how we're thinking about a situation and the set of beliefs we have about ourselves. Difficulty concentrating or focusing. So this is another big one. It's another big one that we saw, especially as we tried to transition teenagers to online school. Online school is very, very difficult for even the smartest of kids. There's only really a small percentage of students who are really suited for online school. Most, as much as they might complain about it, are more suited for in-person classes and teaching and learning. So obviously, this is a kind of a tricky symptom because it can be caused by a number of things. Anxiety, ADHD, depression, simply having too much stress or a lot of things going on in their plates. All of those can cause a difficulty in concentrating or focusing. Where we're looking here is, again, what's normal and what's not normal for your teen. So if your teen is making comments like, I'm reading the same sentence or paragraph multiple times, I can't comprehend it even after I've read it multiple times. If you see a sharp decline in their grades or even a gradual decline over time, comments about not caring about school anymore when previously they were a pretty good student or seemed like they cared about their academic success. All of those can be pretty good red flags that maybe this difficulty concentrating or focusing could be related to a mood symptom. You may notice things like your teen spacing out when someone is talking to them. They just sort of veer off, and you can sort of see where they lose them, or where you lose them. If you have concerns about ADHD, right, there are going to be some other things that you're looking for. Particularly, you're going to think back sort of to how your teen has been sort of through the time span growing up. Obviously, ADHD is a whole different beast, and it manifests very differently in male teens and female teens. So I'm not going to spend too much time getting into that now. But just know that difficulty concentrating or focusing or complaining of these things when there has not ever previously been a problem of that is possibly an indicator of depressive or mood symptoms. This is another big one for teens. Loss of interest in hobbies or activities or friends. So we already talked about the isolation part. So I don't want to hang out with my friends, or I don't feel like hanging out with my friends. But again, if we're on this vein of what's normal and what's not normal, again, with the whole coronavirus thing, a lot of teens were forced out of their normal activities. So what's normal is for them to be missing that, for them to be wanting to get back to that. But it's also somewhat normal for during that break period for the teen to maybe decide that their interests have changed. Like, I actually am kind of grateful I had a break from baseball. I'm thinking maybe I want to play soccer next year instead. Totally normal. Or, I've been a cheerleader for 10 years, but I'm just starting to feel like that's maybe not for me anymore, and I want to explore some other options, or I want to focus on my grades. Those all sound pretty normal, right? But if a teen is losing interest in everything that they love, right? So they're just wanting to stay in bed all day, maybe just stay online all day. They're not wanting to get out and be active at all. They're refusing to do things that they're very passionate about. Then there's a red flag there. Okay, so totally normal for your teen's interests to change, but a drastic shift, totally quitting without any other indicators, that's more of a likelihood that we have possibly a mood symptom or depression emerging. Anger and irritability. Again, anger and irritability is totally normal developmental behavior for a teenager. If you ask them too many questions, you're going to get met with, oh, come on, mom, come on, dad. How was your day at school? Fine. Okay, you're going to get those comments from teenagers. But a consistently angry or irritable response when approached about simple tasks or just menial conversation can be a red flag. Okay, so if you're asking your teen to please set the table for dinner, and this is something that they normally do frequently or they usually do with no problem, and all of a sudden you're getting met with, you set the table, I'm not setting the stupid table, et cetera, et cetera, et cetera, and you get sort of a big response to a small task, that's more of a red flag than simply saying, oh, I don't feel like setting the table, Mom. So think about A, the consistency of that anger and irritability, and B, the intensity and whether or not the intensity of that emotion matches the problem, right? So it's perfectly normal for a teen to be really angry or to be angry when a parent says that they can or cannot do something that they really want to do. What's not normal is for the teen to be throwing things, for the teen to cry excessively, slam doors, potentially be aggressive. Those are more signs that there's something bigger going on underneath the surface. So now that we've talked a lot about what you might be looking for, right? Let's talk a little bit about some unhealthy coping mechanisms that you might see that could actually come before the depressive symptoms that you're noticing. So the teen is going to be experiencing those depressive symptoms. Whether or not you notice them is one thing, or whether or not they seem normal or abnormal is another thing. What you might actually see first is your teen starting to engage in things that aren't normal for them or are clearly unhealthy in nature. Phone addiction is one that I want to spend a minute talking about because in the environment that we're in right now, it's one that's a little bit more tricky, a little bit trickier to navigate. So it's very important to remember that generationally, teenagers right now are very much technologically oriented. They all have phones, and the teenager that does not have a phone often feels excluded. They feel like they are not as good as other teens. They feel like they can't be connected. They may have trouble with socialization. Not saying that every teen needs to have a phone, but just trying to help people understand that that's sort of the thought process of a teen because so many teenagers out there are on their phones a lot. Texting, Snapchatting, et cetera, has become the norm for communication between teens. So when you enter the age of a pandemic and you ask teens to totally isolate from each other, but for technological connection, it is pretty normal that they are going to want to be on that phone 24/7 as much as often, worse than usual, or that Xbox or whatever, because it's their primary method of communication. When they're in school 8 hours a day and they see people face to face, it's not quite as necessary for them to be glued to the phone all the time. Now, some teenagers might still have this problem, but in general, the phone addiction thing doesn't seem quite as bad because they get that one-on-one interaction at school. So currently, if what you're seeing is your teen is more addicted than usual to the phone or an Xbox or a PlayStation or other gaming mechanism, it might just be a normal consequence of the pandemic. However, it's still something to keep an eye on and to watch out for. Obviously, things like running away, drugs and alcohol, finding vaping apparatuses, things like that, is a red flag. Vaping is fairly common among teens right now, and the normal thing is that your teenager tries drugs and alcohol, maybe marijuana, maybe vaping, drinking, whatever. Obviously, harder drugs, it's not as normal for a teen to experiment with that, but it is normal for them to experiment with these things a couple of times. Not saying that that's okay, but that's just what is kind of developmentally expected. It's not as normal if you're finding that your kid is addicted to one of these things or you're constantly finding things hidden in their room, that kind of thing. That's a red flag that potentially you need to seek treatment or that they're trying to self-medicate from something. Reckless behavior like driving too fast, engaging in risky sexual or online behavior, those are red flags that we have a self-esteem or a depressive or anxiety problem. And any violence or aggression, especially violence or aggression that is not normal. So some kids are aggressive sort of growing up and they work through that and it morphs into depression or it's treated. But Not always, obviously, and many kids don't experience any of those things. So if you notice that you, for example, are trying to determine if your kid has a phone addiction and you go to take their phone away and they come at you, that might be a red flag that we're looking at a depressive disorder or a phone addiction or something more underlying going on. Let's move on now to what everybody really cares about, which is what you can do about it, okay? So remember earlier, what I said was that it's not very likely that your teen is going to open up to you on their own. Some parents and teens have a special relationship where they feel like they can be really open with each other, but that's not usually the case. Teens are in a stage of development where they are trying to figure out their independence and they want to learn how to do things on their own. They're separating and individuating from the adults in their life, and that's perfectly normal. But some of them, when they're in that stage, it's still sort of a stage of turmoil, and they will respond better than you think to just sort of periodic check-ins. Hey, how are you doing? Is there anything I can help with? Do you need anything from me? Are all questions that might facilitate a conversation. Don't be surprised if they shut you out first. No, I'm fine. If you're still noticing some of these symptoms with your teens, be persistent, but be gentle. And when they do open up, make sure you validate their emotions. This is something that I cannot press upon you as parents enough. One of the reasons that kids do not open up to parents or other adults in their lives is that they feel like their emotions will not be validated and that they're going to be lectured, okay? So if they come to you and end up saying, you know, I actually am feeling sad a lot of the time, and your response is, how can you be sad? You have a car, you have a phone, you've got friends, you've got a roof over your head. There's nothing to be sad about. As much as that might be coming from a place of good intent, it's going to cause your teen to return inward and shut down from you because now they feel like their emotions have not been validated. Simply saying to them something along the lines of, being a teenager is really hard. I can totally understand why you might be feeling a little bit sad or a little bit angrier than usual, or you're struggling with stress more. That can go a long way to opening up your teenager to feeling like they can talk to you. Be careful to listen and not lecture. When I was a teenager, back in my day, those are all sentence stems that are not going to end well for a teenager-parent conversation, all right? Sometimes what a teenager wants and needs is a simple validation or understanding that they are being listened to versus a problem solver. So a lot of times parents will problem solve for their child. Well, have you tried doing this? Well, have you tried doing that? And really all the kid wants is for the parent to say, hey, I'm here for you and it's going to be okay. Encourage social connectedness. First and foremost with you, make one-on-one time with your teen a priority. Try not to interrogate and let them do the talking. So you might sit down with them and just say something like, hey, I'm here if you need to talk, while they're, you know, sitting at the kitchen table eating breakfast. But don't force it. Okay, if they don't want to talk, they don't want to talk, but your presence there and your ability to be around them and let them see you is what's important. Encourage participation in sports, clubs, or volunteer work. So obviously a kid who's depressed, as we talked about before, might be shying away from this kind of connectedness. But what you might do is sit down with them and have a list of options and say, hey, do any of these sound interesting to you? If not, hey, why don't we try them together? You know, giving them different options for getting involved. Volunteer work is a big one. Finding a humane society or soup kitchen or something like that, helping others goes a long way in alleviating some depression. Don't forget to acknowledge and to understand their need for social interaction with friends, especially right now when parents are still a little bit freaked out about the coronavirus stuff, and understandably so. Make sure that you're validating how hard it is for them to not be around their friends. And when you do feel ready to let your teen see other people again, make sure that you are helping them balance their need to do things around the house, their need to uphold responsibilities, along with their need to see other people. Help your teen take care of their physical body. This one is tricky because teenagers are in that individuation stage and they want to do things on their own. But it is important to note that the health of our emotional body is almost always connected to the health of our physical body. So we're going to encourage exercise, walking the dog, throwing a baseball, jumping on a trampoline. Any movement is good movement. Just taking a walk in general, riding a bike. You don't have to tell them that they need to go out and run 3 miles. Just get them outside and get them moving. Encourage them to do a workout video with you inside, or find a YouTube 10-minute something. Just get them moving. Healthy eating. I know this one is really challenging, especially for the working parents out there. Prepare balanced, nutritious meals when you can. Talk about healthy eating and the importance of it. If you need to order pizza one night a week, okay. If you need to do, takeout, fine. But just make sure that you're balancing that, and to provide healthy snack alternatives. Make sure that there's fresh fruit when possible and things like that a kid can choose instead of, that sleeve of Oreos that we talked about. Limit screen time within reason. So we don't want to go crazy on limiting screen time, but in general, the rule of thumb tends to be around 2 hours a day is acceptable. More than that gets a little dicey. It's typically harder with older teenagers to limit their screen time, but you might want to think about things like video game usage as being screen time as well, and that one's a little bit easier to regulate as far as setting specific times that they can use it and not use it. And then enforcing healthy sleep hygiene as much as you can. If your kid is really struggling with sleep, looking into getting them a sleep study, visiting their primary care physician, going to see a professional if needed for sleep. I can't emphasize enough that if we're not sleeping, there's no way that we're going to feel good. We're going to be irritable. We're going to be cranky. So sleep is very, very, very important. Remember to trust your gut. If you feel like something is wrong, chances are that there is something wrong, and you may need to go to an outside source to find some help for your teen. Maybe it just is as so much as you going to an appointment and talking with a psychologist or a licensed professional who can help you determine if what you're seeing is normal or not normal behavior. If your teenager won't talk to you, seek any trusted third party. So a counselor, a therapist, a school counselor, a teacher. Just getting them talking is important. Getting the teen to open up is honestly the most important thing. Get help from a professional. Depression can be really difficult to treat in teens because often they don't want to talk about it. Methods include cognitive behavioral therapy, where we're teaching kids how to identify and challenge their thinking, dialectical behavioral therapy, where we're teaching them how to manage difficult moods or intense emotions may be used. We might have to seek med management for symptom stability. But one thing that I find really helpful for teenagers, especially teenagers who aren't really willing to open up or who are afraid of treatment or who don't want to see a stranger or are resistant in general, you might want to look into an alternative therapy method. So here at McCaskill, we also offer equine assisted therapy. This is where the teenager would work in a group or individually with a horse partner as well as a therapist. And they would engage in all of those same therapy modalities I just mentioned, like CBT and DBT, but they would do it outside at the barn with a horse. So not only are they getting a different sort of treatment method, but they are outside, they're moving, they're socially connected to others because it's a group, and they're getting the chance to work through things in real time. So we might elicit frustration and help them work through it. We're going to put them in situations where they feel their self-esteem build because of their success with the horse and that kind of thing. So especially for treatment-resistant teens, equine assisted therapy can be really good. But I would recommend it for depression in general, just because it helps facilitate the conversation with the teenager. If you're interested in more information about that, we have a webinar that you can see as well, totally dedicated to equine assisted therapy. If your teen enters treatment, make sure to stay involved. Ask questions of the treatment provider, attend sessions with your child when asked, make sure your child is attending sessions, taking medications as prescribed. It can also be helpful to track changes in symptoms. So if you notice that your kid is, I don't know, not going to bed until 3 o'clock in the morning and then they start going to bed at midnight, that could be a good sign, and vice versa. If you notice crying spells or panic attacks, try to keep track of when and where those are happening and maybe why. What are the triggers to some of those symptoms? Very, very, very important to remember to respect your teen's confidentiality. Depression in teens is a scary thing. Teen suicide is a very real thing. But in order for their treatment provider to do their job, the teenager has to feel like they can trust that provider. So in order for them to do that, you must also trust that your child's provider is going to alert you of any risks to safety or need to know information. Make sure that your treatment provider is having that confidentiality talk with you and your teen at the beginning of treatment about what will be disclosed to you and what will not. Okay, often we talk about how anything directly impacting the child's safety is going to be directly reported to the teenager's parents with, the teen's knowledge. But things like maybe having sex for the first time consensually or trying marijuana once or things like that will be able to be kept between the provider and the teen so that the teen feels like they have a safe place to work through those issues. And remember to take care of yourself. So teen depression can be hard on the whole family. So make sure you get physical exercise as much as you can, engage in stress management. We do have a stress management webinar that you might want to take a look at if you're interested. We also have an adult mindfulness equine therapy group that allows adults and parents to get together and learn some mindfulness techniques and skills to help you cope with life on a daily basis. Encourage family openness and welcome questions. Remember that kids know when something's wrong. So if a sibling is struggling, the other sibling is going to want to know what's happening. Work together with your family to figure out how to have these discussions, but don't hide it, okay? Because that just breeds sort of that suspicious and uncomfortable feeling as far as talking about emotions and thoughts and feelings. Most importantly, be patient. You have to trust the process. Depression in teens can sometimes take the better part of a year to start really seeing solid improvement or long-lasting improvement. So model this for your child. If they start saying, therapy's not working, my meds aren't working, encourage them to trust the process and take their time. Encourage them to be open about maybe some of those alternative treatment methods that we talked about if office therapy isn't doing it for them or they don't feel comfortable there. But it's not going to happen overnight. If your teen is depressed, it's because they've had things sort of compound over time, most likely. So it's going to take time to work through those issues. Just to finish up, you can either email office@mccaskillfamilyservices.com or you can call 734-416-9098 or visit our website, mccaskillfamilyservices.com, and get more information about any of these groups. For equine therapy, we have adult mindfulness, we have emerging middle schoolers, we have teen girl and teen boys. We also are going to be doing a leadership camp this summer, the last week of July. We offer a teen DBT group that is not equine therapy, social skills for middle schoolers. So there's a lot of options out there besides just one-on-one talk therapy to encourage your child to open up. All right. So if you are witnessing any of these symptoms, or especially if you have any fears or worries about being able to keep your child safe, make sure to seek help. If you're worried you cannot keep your child safe, call 911, take them to the nearest emergency room as soon as possible. But if you're just sort of feeling like maybe something's a little off with your teen, the best thing you can do is to try to get them talking. And if they won't talk to you, seek help from a trusted adult or licensed professional. So thank you guys for your time. I hope you found this helpful. Remember that this is a strange time in the world for everybody. So it's probably pretty important that you seek advice on whether or not things are normal or not normal, because everything is just a little bit abnormal right now. Thanks, guys, and if you need any more information, please don't hesitate to contact our office.